This conference will now be recorded.
Good afternoon, everyone. Thank you for joining the lecture series on research methodology. My name is Dr. Prito Sundar Maharana, PG Scholar, Department of Panchakarma, A&U TBI College and Hospital. Today is the 11th day of our lecture series. It is the great pleasure for me to introduce our speaker. Today we have guest speaker Dr. Anita Wanjari ma'am. She is going to present the topic on information about Institutional Ethics Committee IEC and Animal Ethics Committee AEC and their functions. She is a professor at Mahatma Gandhi Ayurveda College, Hospital and Research Center, Wardha, in the Department of Rasastra and Vaishaja Kalpana. She has done postgraduate in the subject of Rasastra and Vaishaja Kalpana from GAC Nagpur. Her name has appeared in national and international periodicals. She has given talks at international, national, and regional conferences own accolades on a global, national, and regional level. On her name, she has 2 patents and 9 copyrights. Now, I would like to welcome Dr. Anita Santosh Rao Wanjari ma'am to present today's session on the topic of information about Institutional Ethics Committee and Animal Ethics Committee and their function. Welcome, Dr. Anita Wanjari ma'am. Welcome, ma'am.
Thank you, Dr. Prito. If I am audible
Yes, ma'am, you are audible.
and my screen is visible,
Yes, ma'am, your screen is also visible.
okay, thank you very much. So today's my topic is information related to an IEC and IAEC, Ethics Committee and Animal Ethics Committee. So I will try to elaborate these topics. My learning objectives regarding this whole presentations are to understand the objectives of IEC. IEC के अपने objectives हैं. What are the roles of IEC? To understand the constitution of IEC and the responsibilities of the IEC. Similarly, Animal Ethics Committee is having its own role. So, what are the objectives behind Animal Ethical Committee and what are the roles of Animal Ethics Committee in the research? So, these are my learning objectives of this whole session. Now, if we see the Ethics Committee, it is a gathering of different disciplines. It is a gathering with the different visions. If we go with its definition, a committee formally designated to review and approve the initiation of clinical research which involves the human participants. Not only that, review and approve. Afterwards, you have to continue the review of the research study which is approved from the ethics committee. So, under ethics committee, reviewal is a one part, giving approval to the study, it is another part, and third part is whatever the ongoing studies are there, they have to be reviewed. There are particular criteria for reviewing. Every project, it is not reviewed by IEC once it is started, but certain areas are there like vulnerable populations like children's ANCs, lactating mothers, psychological studies. All these are the studies which requires intermediate review. So IEC is this ethics committee is having all these the roles to review, to approve, and continue reviewing of the studies. So it is known as intermediate review. This ethics committee, it is dealing with the human participants. Here I have bolded the words human participants. So ethics committee is dealing with the whatever the studies related with the human participants. And similarly, animal ethics committee, it deals with the studies of the animals which are related to animals. Many times, what is the need? Many times we are thinking that being the students, PG students, आप सब लोगों के protocols हो गए submit? Is
मैम DRC हो गया है, IEC नहीं हुआ अभी.
so you must be having this kind of thought कि ये IEC क्यों है and why they are looking after all that things, no? Many times IEC का एक डंडा होता है, जैसे नेक्स्ट स्लाइड में मैं दिखा रही हूँ कि इट इज IEC is like a master, है ना?
Ma'am, slide not moving. Now it is first slide only.
Okay. लर्निंग ऑब्जेक्टिव की स्लाइड आई है आपके पास?
No मैम, अभी तक आई नहीं है मैम.
Only first slide is there.
जी मैम. हाँ, now it is moving. Yes.
Now learning objectives are there. So we have discussed what are the objectives of IEC. Hello. Hello.
Hello. Yes.
The learning objectives we have seen. Then
Yes.
ethics committee we have seen. Now my slides
Yes.
are moving.
Yes ma'am.
They are moving.
Slides. Yes ma'am, they are moving.
Okay. So if we think that what is the need, जैसे आप बोल रहे कि आपका डिपार्टमेंटल रिव्यू हो गया है and you are the IEC is still to be happened. Okay, so you are waiting for IEC and many times we consider that we are correct at our level. जब हम स्टडी डिजाइन करते हैं हमारे सुपरवाइजर गाइड and we the personally being the scholar.
जैसे अभी मैंने लिखा था कि मैं एलटीसी क्लेम करूंगा, ठीक है, तो ये साल में तो कर सकते हो ना, कभी भी आगे जाके.
So there are many conflicts regarding this. IEC why it is so stringent? इसका रोल क्या है? Why it is there? What is the need? जब हम पूरी तरह से देख चुके हैं, अच्छे से कर चुके हैं, तो इसका नीड क्या है ना? So let's see this slide. Now you can see that a teacher, is it visible? A teacher
Yes ma'am.
who is very stringent and strict one. So IEC is like that. पर ये होता है कि जो स्ट्रिक्ट टीचर होता है वो आपसे बेस्ट से बेस्ट निकाल लेता है ना? मतलब he is not allowing you to do anything wrong. He will ensure that you should score proper marks. He will ensure that you should not get fail. So all these are the responsibilities related with the teacher. If we say that whatever the protocol I have done, and IEC if the IC is flexible, lenient, tolerant, mild, I will not get the proper result. What is opposite to stringent? What we had seen here. तो IC अगर flexible हो जाएगी, mild हो जाएगी, gentle हो जाएगी, तो it cannot possible that it should have its gain its own goals. Okay, if we say that the need of IC, the IC is established to formalize and satisfy the commitment of institute towards community. In between these two lines, so many things are there. Okay, in between these two lines, so many things are there, like to promote high standards in research. Research का एक अपना standard होना चाहिए, should be accepted. Whatever research you are doing and publishing, it should be accepted everywhere. Like if you are saying that if you are taking sample size, at the level of PhD, it is okay that you are doing the piloting, but at the level of PhD, accurate sample size are needed. PG is considered as a partial completement. It is a partial fulfillment. Thesis is considered as a partial fulfillment of the degree. But in the PhD, whole the dissertation thesis, it is having a different standards. So accurate sample size it is needed, and for that the research should be appropriate. उसके लिए sample size in clinical study, sample size is a very important factor. Nowadays, what are sample size calculation we are having till now? अभी तक हमने देखा है कि prevalence is considered for any sample size calculation, but nowadays it is not like that. It is the effect size, superiority, equality trial, and according to that trial you have to decide which formula you have to apply. Okay, this is one thing कि हर इंस्टीट्यूट को लगता है कि उसका अपना अलग स्टैंडर्ड होना चाहिए, है ना? इसलिए because whatever the good standard, good researchers, they will they will be published in good high quality journals. तो इसके साथ में आपका भी नाम बढ़ेगा और इंस्टीट्यूट का भी नाम बढ़ेगा. So these are the objective behind promoting the high standard research. Apart from that, ethics in patient care, which is very important. While doing the high standard research, you have to take care of ethics in patient care. Patient जो है तुम्हारा जो community participant है, he should be taken care of in every aspect. She should not be harmed. She should not be harmed by any way. He should be benefited with your treatment. This is the things which has to be ensured. Okay. While designing the research, it should be the professional education. All these are points. All these points should be covered in the clinical research. So if I am not stringent, being the IEC secretary, I am working as IEC secretary at here. If I am not stringent enough, I am not like that. छड़ी लेके तो नहीं बैठती हूँ मैं, but I should be stringent enough that what is correct and what is incorrect. I should judge this thing. It is not only my duty. There are so many participants under the IEC who are having their own vision. They are having their own perception regarding one protocol. हर कोई अपनी अपनी तरह से सोचेगा. मतलब clinicians are there. Apart from that, a layman is also there who can be the party in your clinical study. Okay, when he will be the party in the clinical study, he can understand what is correct with him and what is incorrect with him. Again, some social activists are there philosopher are there. Philosopher, he will take care of कि कहीं किसी community को कहीं ठेस ना पहुंचे. While doing your research, it should not affect any community. Okay, so everybody is having its own role while deciding the approval. It is not like that कि मैंने decide किया, मैंने अच्छे से protocol prepare किया, DRC मतलब department had approved it and IC had rejected it. So it is autonomous. IC is always autonomous. It goes with its own way, and nobody is mine, my. It goes like that. Okay. कोई मेरा शत्रु नहीं, कोई मेरा दोस्त नहीं. It goes like that. So IC has to go with stringent rules and regulations. If we see with the objectives of IC, they are to ensure the protection of dignity, right, safety, and well-being of research participants. Whoever the community participant is there, जो है participant, उसका dignity, right, safety और उसका well-being, इन सब का जो है protection होना चाहिए. And IC has to ensure for that thing. Okay? It is not the work of a single person, chairperson or secretary. Okay, so all the heads, IC में मैंने आपको काफी सारे heads दिखाए थे. So it is a duty of every head that they should take care of all that things. To ensure a competent review of all scientific and ethical aspects of research projects, proceed in compliance with appropriate laws and welfare of the subjects. Any ethical issues are coming for them in related with the welfare of subjects. You have to ensure all that things. Being an IC secretariat or IC person, it has to be ensured. Apart from that, जो भी body है, जो IC में जो body है, all the members, they should be professional and administrative and support staff about ethical issues. ऐसा नहीं है कि layman कोई भी बिठा दो, but he should have some vigilance regarding and some knowledge about ethics, do's and don'ts, etc. He should have the knowledge, do's and don'ts related to ethics. So we have to choose such a person who are having the knowledge about other things. For that reason, ये सारे एजुकेशन प्रोफेशनल, ये जो सारे मेंबर्स हैं, उनका एक ट्रेनिंग प्रोग्राम भी होता है अंडर GCP गाइडलाइंस. उनका एक ट्रेनिंग प्रोग्राम होता है, गुड क्लिनिकल प्रैक्टिसेस, and it is mandatory that they should attend that GCP का, and it is a continuous program. It is not like that once they are done and it is एक बार सर्टिफिकेट मिल गया and they have to forget. ऐसा नहीं है. It should be continuing. Okay? So that they can recall all that things. What is correct and what is not correct. IC is having certain responsibilities that we are all aware that there are certain risks in each and every studies. In Ayurveda, we are lucky enough that हमारा पूरा सेफ्टी डाटा तैयार है. हमारे आचार्य ने सब बताया वो है, अगर अपक्व भस्म सेवन करोगे तो ये होगा, है ना. इसकी मात्रा इतने इससे ज्यादा नहीं होनी चाहिए, मतलब एवरीथिंग दे हैड रिकमेंडेड. वी आर लकी enough. But in modern science, they are having the evolution of different molecules. New molecules are evolved and then they were tested on the animals and then they comes to the community. If you must have studied that phase 1, phase 2, phase 3 studies, clinical trial studies are का जो आपने पूरा पैटर्न देखा होगा, तो उसमें you can get this thing. So every study is having some risk, inconvenience and harm to the human participants. तो अगर ये कोई रिस्क नहीं लोगे तो कोई स्टडी भी नहीं बनेगा. ये भी है कि रिस्क नहीं लोगे तो स्टडी भी नहीं बनेगा. But the risk should be minimum. It should be very, very minimum. You should try for that thing. Okay. जैसे analgesic है, तो if in a one study, if you are giving it for longer duration, सालों दे रहे हो, the IC has to take care of कि कितने दिन तक देना चाहिए, है ना. मतलब आपका 6 months duration if you are taking, whether it is appropriate, it is required, it has to be taken care by the IEC members. There are certain clinicians, there are certain scientists who are looking after all that things कि ये appropriate है या नहीं. The duration you are saying it is appropriate or not. Some scientists are there who are taking care of that thing कि whatever medicine you are recommending. In Ayurveda, many herbs are there which comes under endangered plant. They are endangered plant, or many times they are considered among the having. There are so many ambiguity regarding medicines. तो ये जो संदिग्ध द्रव्य है, तो इनके बारे में they will take care of कि whether it is feasible or not. At departmental level, it is reviewed properly. Then SRC is taking care of all that things. Apart from that, the scientists they are fixed in that way that they should take care of all that things also. The aim of the IC is that the protection of participants by assessing the various parameters involved in the research study. It is a main aim, and apart from that, the duration, dose, it is a part of this thing only. But what are medicines you are recommending, whether they are available, availability, ambiguity, all that things are taken care by the IC only. Is it clear to everybody? You are getting me? Yes?
Yes.
If we see the IC composition, a chairperson is there. राजा है ये chairperson. Secretary is a pradhan. उसके अंडर में काम करेगा, but he is doing all sort of work. Okay. These two are the very important members, chairperson, secretary. Other than them, two clinicians are there. हमारी जो है आयुर्वेद एथिकल कमेटी है, so an expert from ASU will be there. Ayurveda Siddha or from Unani expert will be there. Two basic medical scientists will be there. तो ये जो दो क्लिनिशियन हमने बताए हैं, the two clinicians, they are just the clinicians, they are not having the academic expertise. Okay, so being a clinician, what are the problems they are facing? अगर कोई मेडिसिन देते हैं तो किस तरह के प्रॉब्लम्स हो सकते हैं, they can tell it in a better way. So two clinicians are there. So we are preparing that one from the medicine side and another from the surgery side. We are preparing that. It is at our institute we are preparing like that two different views they should come. Like one is a ASU expert, Ayurveda expert. Okay. Two basic medical scientists should be there. Among these, one should be pharmacologist. One should be pharmacologist, and one should be either from Rasashastra or from Dravyaguna department. So it is a combination of the they should be academician, both of them, they should be academician. Pharmacologist as well as Rasashastri or Dravyaguna person, they should be the academician. They are taking care of the availability of the medicines, the dose, the duration, all that things they are taking care of. Legal expert is there who is looking after legal matters related with the participants. जो भी study participant है in the community, they are taking care of ये जो participants है उनका care करने के लिए legal expert is there. This legal expert, he will take care कि whatever the protocol is there, it is legally, it is should not have any legal issues. Okay, and apart from that, he will take care कि अगर उसको participant को कुछ हो जाता है, in that condition, what is the whatever the remuneration we are supposed to give to the patient, he will take care of all that things. जैसे मैंने बताया आपको कि it is a very stringent mechanism. IC has to go with very stringent mechanism. Apart from that, if any untoward effect which are observed on the patients, in that case he can claim, जो भी उसका claim है, in that condition legal expert will take care of all that things. Okay, then legal expert has to look after the consent form. जो consent form आपने बनाया है, it is proper, appropriate or not. Along with secretary, chairperson, legal expert has to take care of all that things. Okay. One social scientist will be there. Social workers, they are aware about the social problems, so he has to be there, and he can raise his queries or he can raise his unacceptance of regarding the protocol. One philosopher is there. This philosopher, he has to take care of the religious material, religious matter, like it should not affect any community. किसी रिलीजन के ऊपर में, किसी कम्युनिटी के ऊपर में कोई भी अन्याय नहीं हो रहा है, या उनको ही हम लूप में नहीं ले रहे हैं. All that things is taken care by the philosopher. A lay person should be there, but a lay person should not be angota chap. He should be well versed with the ethics. He should be well versed with the ethics. He should have the that kind of vision कि अगर ये सामान्य किसी कॉमन आदमी को दिया जाता है मेडिसिन, तो इससे उसके ऊपर क्या परिणाम हो सकता है, एंड इफ लाइक अगर सिर्फ फीमेल्स को दे रहे हैं तो वी आर नॉट गिविंग इट टू मेल, तो ये कहीं से उसके ऊपर अन्याय तो नहीं है. ऑल दैट थिंग्स हैज टू टेक, दिस ले पर्सन हैज टू टेक केयर ऑफ while giving it to the children, male children, female children, all that things they have to think thoroughly. Lay person has to be very more attentive in all this aspect कि उसको अगर वो he is representing the community, अगर वो सोच रहा है कि मेरे बच्चों को, मुझे, मेरे पति को, एनी पर्सन, ये सारी मेडिसिन हमें दी जा रही है और उसके कारण अनटोवर्ड इफेक्ट होगा क्या, नहीं होगा, ये सारी चीजें. If anybody is saying कि my medicine has to be given at 4 a.m. only, so lay person will say कि no, it is not possible. 4 बजे सुबह उठ के लेना है ये मेडिसिन, 4 बजे सुबह उठ के आपको प्राणायाम करना है, तो ले पर्सन कैन रेज दिस थिंग कि ये पॉसिबल नहीं है लेमैन के लिए. So this is the role of layman regarding this. Chairman has to take care of the that meeting should be conducted properly, and he has to take care कि this is a autonomous functioning. It should not be burdened by somebody. अगर कोई प्रोटोकॉल अगर चेयरमैन चाहता है और ऑल द मेंबर्स अगर दे आर नॉट हैविंग द दे आर अगेंस्ट द प्रोटोकॉल, तो उसको कोई आपको फोर्स नहीं कर सकता। मतलब इंस्टीट्यूट हमारा है और हमारे यहाँ के प्रिंसिपल हमको फोर्स नहीं कर सकते कि यू हैव टू पास दिस प्रोटोकॉल। This is the autonomous functioning of the IC. Secretary has to organize the meetings, and whatever the SOPs of the ethics committee, they have to be proper executed. जो भी minor corrections अगर बताए जाते हैं, so after the meeting they have to be reviewed, and the secretary will take care of all that things. Secretary will take care ki the after the meeting conducted, after the conduction of the meeting, the approval should be given, and certain minor corrections if suggested, they should be reviewed by the secretary, and the data maintenance of all that things should be done by the secretary. Now ICMR, we are having certain guidelines regarding the conduction of IAC. So ICMR guidelines, we are following the ICMR guidelines in our institute, and ICMR has given 4 basic principles. They are the beneficence, justice, autonomy, and non-maleficence. So these are the Latin words. We will see what they are actually and how it is related with the patient and the ethics committee. If we see the beneficence, in this we are taking care of what is best for patient. So ICMR says that you have to choose such things which are best for the patient. It may include physician judgments and patient's wish. Okay. Whenever we are choosing one modality, treatment modality, we should have to take care that it is best for patient. Whenever we are saying that RCT, randomized control trial, we are taking one group as a standard one, and another group, whenever we are taking another group, we are never taking the inferiority trial like things. उससे कम है उसको हम कभी नहीं लेंगे. We are, what is our claim or what is our hypothesis कि मेरा ये जो दूसरा ग्रुप है, it is more better than the standard one, or it is equally better. It is equality trial, what we can say, and also better in term of cost effectiveness or easy to available, then palatability, all that things are there. So but what we are taking care ki it should be best for patient. It is not like that ki it should be inferior to the patient. जो best है, gold standard है, उससे कम हम ले रहे हैं, ऐसा नहीं होता है कभी भी. So you have to justify whenever you are choosing certain drugs. कोई भी ट्रीटमेंट मोडालिटी अगर आप चूज करते हो तो आपको उसका जस्टिफाई देना पड़ता है कि हाउ व्हाई यू आर चूजिंग दिस वन and how you are feeling that it is better than the existing. Then the next one is the autonomy. It is a respect towards the patient's self-determination. At any point of time, patient can leave your study. He can reject that I'm not going to continue at any point of time. Okay. Patient जो है वो अपने को डिसाइड करेगा मुझे whether I want to be in the study or not. Okay. So it is known as autonomy. Once he has given consent, it is not like that he should have to be continued. At any point of time, if he is unsatisfied with your treatment or anything like, he can withdraw himself from the study. Okay, we are saying that it is a dropout rate. Then justice. This is a third basic principle the IC Hammer is giving. So whatever therapeutic utility, it should be new treatment modalities for whatever your research study. It should have the utility for everybody. मतलब that particular group of point जैसे हम case control ले रहे हैं मतलब it is for the females of the having the low anemic females ले रहे हैं but it should be have the similar effect on everybody. Wide range of utility should be there. It is not that everybody will be get benefited, but wide range of effectivity we should get. The next one is a non-malfeasance. It is a very first very important part in the ICM under the ICMR guidelines. What it says ki you have to take care that first whatever you are choosing, it should not do any harm. First, do not harm. Okay. Once you are saying beneficence, what is the best for patient you are taking care of? Okay. But when we have again discussed this thing ki everything you are taking, it should have some ifs and buts. The minimum risk. When you are saying that it is having the minimum risk, but from your side, you should not be careless. This carelessness, it is considered as a non-malfeasance. You should not harm by carelessness. You should not harm to the patient by carelessness. You should be attentive, careful towards your patient. जितना जरूरत है मतलब if you are taking one group as a suppository or one another group as a injectables, so injection it is going to give some pain to the patient, but unnecessary you are giving something which is causing harm to the patient, your carelessness it is causing harm to the patient, it is not acceptable at all. Okay, it is known as a malfeasance. How the ethical committee it works, the whatever आपका DRC हो गया departmental review committee हो गया है तो then it will come to SRC for the initial review. SRC scientific review committee, it will take care of the all the proposals and submit to the IC with the detailed comments. SRC again consists of some certain expertise from the institute only. They will review them and submit to the IC secretary with their own comments. Then it comes to IC. In the meeting of IC, the proposals they are discussed and reviewed. Under this, again 3 categories are there: full review, expedited review, and exempted from review. So whenever new molecule introduction is there, vulnerable population are there, and we finding that more than minimum risk. In all that cases, the full review should be done. Every member has to go thoroughly with all these protocols. उनको हर किसी को ये प्रोटोकॉल से जाना है. Proper review should be there. Then another is expedited review. जैसे IC मीटिंग में बताया है कि मिनिमम करेक्शंस आते हैं, बस इतना कर लोगे तो हो जाएगा. और फिर like कि title correction is there. All the members they decide that title is not proper. It should be like that. So in place of assessment, it should be evaluation. It's the things like that. When sample size, methodology, it is not changed at all. In that condition, it is reviewed by the only secretary and chairman level. This is known as a expedited review. It is an expedited review. Some protocols are there, they are exempted from the review. They are the educational research. They are the educational research. Like teaching learning methods, we are having different methodologies. Chalk and board method. So it is more better than the demonstrative mode. Or this in teaching learning, the presentation, PowerPoint presentation is better than the didactic lecture. All these are the protocols which comes under the educational research. And the last is a periodic review. I have already discussed this thing. When certain vulnerable population, when the studies related to vulnerable population is there, more than minimum risk things are there, new molecule introduction is there. In that case, the periodic review should be taken. And the periodicity of this review should be 3 to 6 months. It should be 3 to 6 months. Apart from that, whenever we are taking the meeting, first, conflict of interest is one most important part. It is a most important part. Here you can see that a person, he may be the chairperson or somebody, who is saying that the protocol is from your department, which means you cannot vote. आप वोट भी नहीं कर सकते and have to leave the room. तो आपको ये जो मीटिंग है वो भी छोड़ के जाना है अभी बाहर. If the protocol is from your department, see the significance. Then if you from that you can understand that अगर any member who is having his blood relation जिसका कि प्रोटोकॉल है या आपके डिपार्टमेंट का किसी का प्रोटोकॉल है और हस्बैंड इफ हस्बैंड इज अ सेक्रेटरी और अ मेंबर और उसके वाइफ से रिलेटेड उसके वाइफ के स्टूडेंट का भी अगर प्रोटोकॉल है इन ऑल दैट केसेस कॉन्फ्लिक्ट ऑफ इंटरेस्ट शुड बी डिक्लेयर्ड. वो that will be declared with that member that this is my relative or he is in this kind of relationship is there with this protocol and he is not supposed to vote also and किसने उसके अगेंस्ट में वोटिंग किया ये देखने के लिए भी he has not to be there in the room. He have to leave the conference और जो भी मीटिंग एरिया है वहां से he has to leave that meeting. Okay, it is that much of important conflict of interest. We have already discussed this thing ki what are the procedures and records. During this whole things one thing is very important. We should be I say respect all the research staff and investigators. We respect the whatever the protocols, whatever the ideas. Okay, but it is not like that we are respecting matlab we should consider them. Okay. After that when the meeting is over, the minutes they should be circulated to all the members for the approval. The approval letters will be issued to the respective investigators. They should be duly signed by the secretary, member secretary. Many times revision letters has to be issued. They will be issued and the documentation of all the things will be done. All these are the procedures and record keeping and documentation related to ethics committee. So if anybody of you are having any doubt, query, you can ask me. Then I will move towards the animal ethics committee. Yes, Dr. Prajot. Okay, Dr. Pritosh.
Yes, hello. Yes, ma'am.
Till now, if anybody is having any query regarding the ethics committee, they can ask me. Or should I proceed towards the animal committee?
No, ma'am.
Okay. Okay, thank you. Yes, please.
Please continue. Ma'am, no question query is there now.
Okay, okay.
Lastly, we are next session.
Okay. Then animal ethics committee. Animal ethics committee, if you see that their animals are a very, very important key factor rather in medical research. In Ayurveda, we not having that much of significance regarding this thing. But when with in allopath, in modern science, they are deriving the new molecule. Whenever they are deriving new molecule, it has to be tested on the mice. It is a pharmacology approach, general pharmacology approach. Ki lab to mice to man. Okay, molecule it is derived in the laboratory, then it has to be tested on the mice. Mice is a representative of the animals, and then it is applied in the human being. Why they are so important? So we cannot directly apply the new molecule on the man. So mice, and all the animals, they has to be very much significant in the medical research. And the ethics, they are very stringent related to the mice. CPCA guidelines are there. They are the nominees from the CPCA. They are coming, and all the protocols they have to be looked very vigilantly, and they are approving the animals according to the need only. Many times we have to sacrifice the animals, but ये sacrifice का भी बहुत ही detailed process है. मतलब we should not do like कि हमारे मेडिसिन से एनिमल मर जाता है तो कोई इश्यू नहीं, ऐसा नहीं है. We have to take record of all that things also. और जो sacrifice अगर करना भी पड़े हमें एनिमल्स को, तो ये बहुत ही विधि पूर्वक होता है. एंथुसिया जो है, it should be very systematic way. It should not like that कि एनिमल ही तो है, मर गया तो क्या. It is not like that. Why the animals, they are very important. You must have gone with the confounding factors. In human study, what we are finding, so many confounding factors are there. Like everybody is having different environment. किसी को हवा चाहिए, किसी को नहीं चाहिए. किसी को गर्म पानी पिएगा, कोई ठंडा पानी पिएगा, कोई फ्रीज का पानी पिएगा. It is like that. The food habits, they are also different with person to person. But if we see the animals, whenever we are doing the study, we are providing the same environment to the animals, same food, and same duration to all the groups. So the confounding factors can be avoided in the animal studies. Now, if we see the what animal ethics committee is defined as a local body approved by the CPC SEA. It is a committee for the purpose of control and supervision of experiments on the animals. It is a committee which is controlling and supervising the experiments on the animals, which has been empowered to permit experiments on the animals. Every ethics committee, though it is from the institute, it has to be approved from the CPC SEA. फिर this CPC SEA, it gives you the registration and permit you for conduction of the experiments. Under this registration, you can breed the animals and use the animals for the experiments. You can breed the animals and can use the animals for the experiments. Okay, so CPC SEA is a controlling body who is taking care of all that things. Though you are having the ethics committee at your institute level. Okay, in ethics committee, and this is not like that. Your institute is defining all that things, but the chairman, he's from the outside. He should not be the part of your institute. So all the things go autonomously. So many out the IEC member जितने भी हैं उसमें से more than 50% they are from the outside. They are not the party or part of your institute. So the things go autonomously. Here in the Animal Ethics Committee, CPCA persons are there who are taking care of everything. In Animal Ethics Committee, the mandatory CPCA members should be there. जब भी Animal Ethics Committee होती है तो though it is institutional, but CPCA member should be there. अगर वो नहीं है तो आपकी Animal Ethics Committee, it should not give approval to any proposal. They are the nominated nomination. They are given by the CPCA. What are the functions of Animal Ethics Committee? It takes the review of research proposals in terms of quality and consistency. And the very important is to prevent infliction of unnecessary pain and sufferings before, during, and after experiments on animal. What CPCSES says कि we should not give the unnecessary pain, suffering before, during, and after experiment to the animals. So IAEC take care of all that things. They review the proposal in that way that we are not giving any pain and suffering to the animals. IAEC is providing the independent, competent, and timed review to the ethics of the proposed studies. Again, same thing is there. The monitoring of the ongoing studies is important in institutional animal ethics committee. It is one of the important factor, and as secretary animal ethics committee has to take care of all that things, and he has to report to the concerned chairman. Animal ethics committee has to ensure that animals intended for the performance of experiments are properly cared before and after experiments. Washout periods is generally after every experiment. Washout period is 2 months, but follow-up period is also there. After doing your experiment, you have to take the follow-up of the animals, whether he is having some untoward effect. Any untoward effect is happening on the animals, you have to take care of all that things. Then if we see the composition of animal ethics committee, I have said that it is some are the institutional members and outside members are also there. A CPC SCA is a main nominee and link nominee. 2 persons are there. जो मेन नॉमिनी है उसका रहना बहुत बहुत जरूरी है. CPC SCA, अगर he is not present, then the committee cannot proceed his work. Then a scientist from the outside of the institute, a socially aware nominee, a social scientist should be there. From the institutes, Here, the chairman and member secretary both are from the same institute, but in the ethics committee, the chairman is from the outside. He should not be from the institute. Here you can see that CPC SEA main nominee is there, who is more than chairman. If he is not approving, chairman can also not do anything. Apart from chairman and member secretary, a scientist from different biological disciplines, biological scientist, and one veterinarian should be there. And a in charge of animal facility, who is taking care of all the animals, he has to be there. And veterinarian should be there also there. He will take care of the all the factors related to the animals. Veterinarian. He should be appointed one in the institute. He will be the member of institute. जो भी जहाँ पर भी एनिमल एथिकल कमेटी है तो एनिमल हाउस अगर है तो वहाँ पर वन वेटरनरियन ही इज अपॉइंटेड परमानेंटली. Then again functioning for IEC, they are near about same, that every member of the committee has equal right to raise and relevant any relevant issues. If he or she is not agree with any protocol, they can give their own comments on that and can vote against that thing also. Similar thing is conflict of interest should be declared. Similar like ethical committee, one has to declare the conflict of interest. Now functioning for any committee, it is a cumulative responsibility of all the members and they have to take care of all that things. Okay. Here we have seen the difference between the ethics committee and animal ethics committee. Okay, the functioning, it is more ever same, even record keeping, it is more ever same. Similarly like ethics committee, secretary has to take care of all that things. If any revision is there, same secretary will take care of that things, but unless and until it is approved by the CPCSEA members, nominee members को पूछ करके ही उनको minutes भेज करके ही secretary has to approve. Rather in ethics committee, in any minor corrections are there, this chairman and the secretary, they can decide at their level. Some expedited reviews are there which can be decided by both of them, but here the thorough review is required. Full review of each protocol is required in the animal ethics committee. For whole this presentation, what I want to give the message that ethics committee and the animal ethics committee, they are both of them, they are the regulatory bodies to conduct the research by giving the minimum pain to, it may be to the human being or to the animals. And while doing all that things, it should not divide of any violation of human rights. किसी भी तरह से human rights का violation ना हो. It should not deviate from the protocol. Whatever the protocol which is approved, the study should not get deviated from that protocol. So it has to be taken care by the IEC, and secretary has to take care of this thing very cautiously, and secretary has to be very vigilant in all that things. Whatever the research studies, they are directly affecting the welfare of living being. It may be human or it may be animals. So why the IEC or animal ethical committee, they are so stringent? इतना stringent क्यों है उनका mechanism? Because they want that minimum risk should be taken. Minimum pain should be given to the human or to the animals. It should be beneficial to humans. It should be beneficial to the humans. But while doing this thing, animals should also not get very much pain. So all these are the things which IC and Animal Ethics Committee has to take care of. Okay, so they are not the bodies which are very stringent. They are the regulatory bodies which makes the research in correct direction, which are giving the proper direction to you people so that your research can be conducted smoothly without any giving any pain to the patients or to the animals. Many times we have to give pain to the animals, but it should be minimum. It should not violate the human rights. So all these things are taken care of by the ethics committee and animal ethics committee. That's all from my side. If you are having any query, please you can ask me. I will try to answer them. Thank you. Thank you very much to all of you.
Thank you, ma'am. Now is the questionnaire session. If any query, please unmute and ask your question one by one.
All are the PG students? Yes. Dr. Pritosh, all are the PG students?
Ma'am, PG student, PhD and faculty member also.
Okay. So faculty members then must not be having, they more enriched than my knowledge.
Ma'am, I have a question.
Yes, please.
जो वॉश आउट पीरियड है वो मतलब डिफरेंट होता है या कोई एक टाइम पीरियड रहता है, उसके बारे में थोड़ा बताओ।
Hello. Hello.
यस मैम।
Hello. Will you please repeat the question?
मैम जो वॉश आउट पीरियड है उसको प्लीज एलाबोरेट कीजिए एक बार जानना
Yes, sure. In animal ethics, generally 2 months consider 2 months time. It is considered as a washout period. जब भी ये होता है कि कोई भी एक्सपेरिमेंट्स हम करते हैं जहाँ पर हम सैक्रिफाइस नहीं करने वाले हैं एनिमल्स को, या फिर टॉक्सिसिटी स्टडीज आर नॉट कंडक्टेड, इन दैट कंडीशन ओनली वी आर doing this washout. So washout period it is generally of 2 months. जैसे हमने एंटीपैरेटिक स्टडी कर लिया है, एंटी इन्फ्लेमेटरी स्टडी कर लिया है, इन दैट कंडीशन washout period it is of 2 months. उसके बाद ही हम मेडिसिन दे सकते हैं, मतलब वी कैन टेक द एनिमल्स फॉर द नेक्स्ट स्टडी. washout period means whatever medicine you are giving to the animals, it is related to with the animals only. So this term it is related with the animals only, and whenever you are giving the medicine to the patient, animals, जो भी animals को आप दे रहे हो उसके बाद में after completion of your study including the follow-up, the duration of 2 months it is considered as a washout period.
Okay ma'am, thank you.
Hello.
Yes.
Yes, ma'am. Ma'am, I have an query. Ma'am, as you said that the ethical clearance is required for the clinical research.
Hello. You are
Hello,
not
ma'am.
proper. Huh.
Yeah, ma'am. Ma'am, as you said that the ethical clearance is required for the clinical research.
जी जी.
Yeah. If I do have observational study,
हाँ
just
हाँ.
like the assessment of BP and Prakti, it is required. Ethical clearance is required in that case too.
Yes sir, definitely. Actually, you are taking the human subjects, no? ह्यूमन
Okay.
सब्जेक्ट्स, और जिसमें आप इंटरवेंशन भी दोगे नहीं दोगे.
Okay. If I am taking the human subject, whether I have taken their blood sample or not, but I have to take the ethical clearance for that.
हाँ, if you are taking मतलब any biological sample if you are taking,
Okay.
in that condition you are requiring the full review. But what you are saying ki only prakriti assessment and the BP.
Just like the BP, ma'am. Yes, ma'am. There
हाँ,
is no blood
it,
intervention.
हाँ, so it will comes under the expedited review. IEC clearance is must, mandatory, but the whole review will not be there. Only the expedited review, the short review, the chairman and secretary can decide the approval. जैसे मैंने आपको बताया कि एजुकेशनल रिसर्च भी होता है, उसके लिए भी आपको आईसी क्लियरेंस लगना ही लगना है, बट इट इज एग्जाम्प्टेड फ्रॉम द रिव्यू. मतलब सेक्रेटरी विल टेक केयर ऑफ ऑल दैट थिंग्स एंड डिसाइड कि इसको दे सकते हैं.
Will you please explain what is the explanatory review and other
Yes, yes,
things?
sir. Full review is something, three parts are there: full review, expedited review, and another is exempted from the review. So the first one, what I have seen is said that full review. Thoroughly, every member has to go with the protocol. जो भी protocol आपने प्रेजेंट किया है या फिर सबमिट किया है, तो हर कोई लेमैन से लेकर जो आपका मेंबर है, लेमैन, फिलोसोफिस्ट, सोशल वर्कर, ये सारे लोग एंड साइंटिस्ट एंड रिसर्चर्स, क्लिनिशियंस, दे हैव टू गो विथ दिस प्रोटोकॉल very minutely. This happens when you are claiming that RCT. आपका ये कहना है कि मेरा जो ड्रग है इट इज बेटर देन द गोल्ड स्टैंडर्ड. Diclofenac से मेरा योगराज गुकुल बेटर है. When you are saying like that, or it is having the equivalent trial, in that condition, full review should be there. Okay, this is with the Ayurveda. But when you are introducing the new molecule, new formulations, in that condition also, it has to be totally reviewed. Every member has to review it and vote for it. हर किसी को वोट करना पड़ता है ये सारे रिव्यूज के ऊपर में, एंड डिपेंडिंग ऑन दैट वोट्स, पॉजिटिव और नेगेटिव, द proposals will be approved or unapproved. Okay, it is not a one man policy. किसी एक का पॉलिसी नहीं होता है ये. इट इज वोटिंग ऑफ द ईच एंड एवरी मेंबर. जैसे वल्नरेबल सब्जेक्ट्स आई हैव ऑलरेडी टोल्ड यू कि लैक्टेटिंग मदर है, एएनसी है, या फिर चिल्ड्रंस है. सो ये जो वल्नरेबल पॉपुलेशन हम जिनको बोलते हैं, इसमें आपको यू हैव टू टेक केयर ऑफ द पार्टिसिपेंट. In that condition, full review is required and the periodic review is also required. आपको एक बार अप्रूवल मिल गया है, उसके बाद में इनका पीरियडिक रिव्यू भी आईसी ने लेना जरूरी है. Okay, so every institute they are having the committee which is taking care of all that things also. कि कितना ड्रॉप आउट रेट हुआ है, any adverse effect is happened or not. So these things should be taken care. Okay, so it comes under the full review. Then the second is a expedited review. Under this expedited review, जैसे previous, if we are having previous research committee और जिन्होंने minor corrections बताए थे, जैसे स्टडी सेंटर आप इफ यू आर सेइंग, या फिर सैंपल साइज आपका तब का हमें कम लग रहा, तो वी हैड गिवन द कमेंट्स कि प्लीज रेक्टिफाई द सैंपल साइज, प्लीज रेक्टिफाई योर टाइटल. सो माइनर करेक्शंस आर देयर. When the minor corrections are there, in that condition, the chairman and the secretary at their level, they can decide कि whether the approval has to be given or not. This is known as the expedited review. Okay, and another one is there which is a exempted from review. सो द एजुकेशनल रिसर्च, जैसे मैंने आपको एग्जांपल बताया था कि टीचिंग लर्निंग मेथड्स वी आर कंपेयरिंग। तो एक ग्रुप को, जैसे यूजी क्लास के लड़के हैं, उसमें से आउट ऑफ 50 आई एम एक्सपोजिंग 25 स्टूडेंट टू द डायडेक्टिक लेक्चर and 25 student I am giving them the demonstrative lecture. जो 25 स्टूडेंट है, जैसे मैं अगर आई एम फ्रॉम शास्त्र, तो मैं अगर कोई मेडिसिन फॉर्मुलेशन उनको बता रही हूँ, तो मैंने उनको ओरली बता दिया है, तो इट इज अ डायडेक्टिक लेक्चर। और 25 लोगों को मैंने डेमोन्स्ट्रेशन करके बताया है, एंड आई एम कंपेयरिंग द डिफरेंस, द इफेक्टिवनेस ऑफ द दिस टू टीचिंग लर्निंग मेथोडोलॉजी, डेमोन्स्ट्रेटिव अगेंस्ट द डायडेक्टिक। तो ये जो टीचिंग लर्निंग मेथोडोलॉजीज हैं, उसको अगर मैं कंपेयर कर रही हूँ, तो दे कैन बी exempted from the review. Directly secretary will take care and he will issue the IEC letter. This is exempted from the review. Is it clear?
Okay, ma'am.
Hashmi, Dr.
Ma'am,
Hashmi. Hello?
hello. Yes,
Huh?
ma'am. I have also a query. If I have done a survey for a just like for the dietary habits in a desired population, it is also ethical clearance required in that case too.
Sir, ethical clearance is mandatory, पर उसका रिव्यू कैसे होता है वो होगा।
वो different. Okay,
हाँ,
ma'am.
जो रिव्यू है वो हो सकता है कि एक्सपेडिटेड रिव्यू में जाए, मतलब उतना
क्या
अगर
ma'am?
if you are not taking any biological samples, then it will comes under the expedited review, but IEC letter it is must. Without that you should not
मैम
proceed.
जैसे बहुत सारी चीजें होती हैं हमारे पास, अब ओपीडीज में रहते हैं, डाटा इकट्ठा कर लिया, हमारे पास वो डाटा आ जाता है, उसे पब्लिश करना चाहते हैं, तो फिर इसकी एथिकल क्लियरेंस तो हमारे पास होती नहीं शुरू से ही। ऐसे में क्या होता है?
हेलो,
जैसे बाई चांस मैंने हेलो हेलो
हाँ, हेलो,
हेलो मैम, जैसे हम ओपीडीज में होते हैं, ओपीडीज में हम हेलो मैम, आवाज आ
हाँ
रही है
हाँ
आपको? हेलो
हाँ हाँ, यस यस, आई एम हियरिंग,
हेलो,
यस
एम
यस,
आई
यू
ऑडिबल?
आर ऑडिबल, यस यस, यू आर ऑडिबल।
मैम जैसे हम ओपीडीज में होते हैं, ओपीडीज में पेशेंट आते हैं, पेशेंट्स आते हैं तो हम उनका डाटा इकट्ठा कर लेते हैं एज ए सर्वे, फिर हमें इसे पब्लिश करने के लिए एथिकल क्लियरेंस तो हमारे पास होता नहीं कुछ ही।
नहीं, तो दिस
तो ऐसे
कम्स
केस में
अंडर
क्या
द
हो सकता है
केस
मैम?
कंट्रोल।
हमें
इट इज अ केस स्टडी, आपका केस स्टडी हो जाएगा ना वो, यू कैन पब्लिश इट, नो इशू। It is a case study, but it is not a
ओके
research. You are not doing any research.
ओके
Whatever happening, you are just documenting that. It is a documentation.
ओके ओके,
Okay?
फॉर दैट आई डू नॉट रिक्वायर एनी एथिकल ना?
No, no, no. You can go with consider it as a case study, na? And as a case study, you can have a much more data, and the cumulative data you can present as a case series also, no?
ओके, नहीं मैम, जैसे हम ऑब्जर्वेशंस भी करते हैं तो वो भी ऐसे पब्लिश हो सकती है? हमने
Obviously,
ऑब्जर्व
हाँ
किया
हाँ,
बहुत सारा, कोई दवाई
नहीं
नहीं।
नहीं, you can go with that, no issue. You can go with that. Whatever data you are collected, you have to publish that. It is very mandatory that whatever new things which are you are observing, it has to be published. ये जो पब्लिकेशन है उसी में से ही आईसी गेटिंग गाइडलाइन। अगर आप बता रहे हो कि त्रिभुवन कीर्ति में हमने पेशेंट को दिया तो उसको इस तरह का एडीआर मिला है, एडवर्स ड्रग रिएक्शंस, तो आईसी विल टेक केयर ऑफ ऑल दैट थिंग्स, मतलब उसके पास वो डाटा रहेगा। और इफ somebody is taking research study on त्रिभुवन कीर्ति, तो आईसी विल टेक केयर ऑफ ऑल दैट थिंग्स ऑल्सो। कि अगर केस स्टडी आपका ये बता रहा है कि पित्तस प्रकृति वालों को इस तरह का हमको रैश मिला है या जो भी एडवर्स ड्रग रिएक्शन मिला है, पल्पिटेशन और एनीथिंग लाइक दैट, तो IC will take care कि in the protocol he has to exclude the पित्तस
और मैम
प्रकृति।
चाहे हमें फिर से इंसिडेंट सर्वे करना है, प्रिविलेंस करना, हमें एथिकल लेना ही पड़ेगा हर ठीक है मैम?
Yes, yes. When you are doing research, you have to take the approval. But if you are documenting the thing from where which is coming to the your OPD from the clinics, you have to publish that. It is not the research. It is the happenings which you are documenting. you get the difference between these two things. It is a happening. It is not a research you are doing on the
Yes, ma'am.
patient. Okay.
Yes, ma'am.
Okay.
Okay, ma'am. Thank you, ma'am.
Thank you. Yes, Dr. Pritosh, if any more queries are there?
I think there is no question further.
Okay, okay. Okay. So thank you very much to all of you for patience
I would,
listening.
I
Yeah.
would like to thank our speaker, Dr. Anita Santosh Rao Banerjee ma'am, Wanjari ma'am, for enlightening us with their knowledge about about institutional information about institutional ethics committee and animal ethics committee and their function. And lastly, thank to all participants behalf of the Panchakarma department. Thank you so much, ma'am. And thank you, everyone.
Thank you. Thank you very much, sir. Thank you.